Yes, that's it. Okay, so basically, good evening. I would like to introduce Nitromedicine. It's a new specialty, and our mission is actually translating alternative medicine to evidence-based medicine and redefining medicine. Also managing oxidative stress-related disease and enhanced stem cell therapy. As you see, these are the team of Nitromedicine. Dr. Yusuf Gureta, he's a stem cell therapy pioneer, orthopedic surgeon, and Nitromedicine director. Dr. Michael Hamlet, he's a very supporter of Nitromedicine, and he's a co-author, and he's a photomedicine pioneer. I call him the father of photomedicine. Wellness Center investigator, Harvard Medical School professor, and Nitromedicine consultant. We have Dr. Praveen Arnay, he's a former photomedicine investigator, Buffalo University professor. Dr. Norman Shelley, he's an energy medicine pioneer, retired neurosurgeon, and Nitromedicine consultant. And then I have Dr. Robert Quinn, he is a regenerative medicine pharmacist and Nitromedicine CEO. So basically, what is Nitromedicine? It's a new medical specialty focused on modulating nitroredox sensitive biochemical pathways and managing oxidative stress-related disease. It has been known since the discovery of the biological rule of nitroxide in the 1980s that supply nitroxide donors such can have many beneficial effects in different conditions by stimulating stem cells and modulating the immune response. However, there also exists a substantial risk of side effects with long-term use. Excess nitric oxide can inhibit mitochondrial metabolism by binding cytochrome oxidase and can also produce reactive nitrogen species, which is peroxynitrate, by interacting with the active oxygen species. To avoid these potential damaging side effects, we propose to combine the use of nitroxide donors with 4 additional components. Initially, we believe that the addition of antioxidants such as thiols, polyphenols, and vitamins can neutralize the active oxygen species, the active nitrogen species. Secondly, we believe that application of appropriate wavelengths and dosage of light, blue, red, or near-infrared, depending on the exact condition being treated, will dissociate nitroxide from cytochrome oxidase and other storage sites, those restoring mitochondrial ATP production, stimulating and healing in many conditions. Thirdly, we believe also in detoxification to remove pathological free radical generators and increase nitroxide bioavailability. Lastly, by delivering electrons to the body, which is through electromedicine, might help to saturate the free radicals with electron dose, eliminating underlying oxidative stress, stabilizing mitochondria, preventing further formation of pathological free radicals, and increasing the nitroxide bioavailability. So I think basically what we're saying here is that photomedicine, electromedicine, and other forms of energy medicine, they are sort of antioxidants, and they help to neutralize the free radicals or buffer the free radicals and modulate the redox signaling, allowing nitroxide to do the good thing, which is stimulating of stem cells and modulating the immune system. This combination therapy can be applied to treat and prevent a large variety of oxidative stress-related diseases such as regenerative disease, immunological disease, chronic infectious disease, cancers, and broad range of unmet medical needs involving chronic inflammation with an emphasis on pain management. I think the better word, even for vitamin C, we are calling vitamin C as an antioxidant, but we find out in high dose of vitamin C, it's actually pro-oxidant. And because of that, I think the best term to be used for those antioxidants is Nitroredox modulators, because low dose of vitamin D does increase the nitroxide bioavailability. Low dose of vitamin C does neutralize the free radicals, but high dose actually is pro-oxidant. To avoid all this confusion, the better word that we can use for all those potential antioxidant, whether it is chemical or supplement or it is photomedicine or electromedicine, I consider them as Nitroredox modulators. So Nitromedicine represents a new era in medicine by modulation of nitroredox sensitive biochemical pathways. We can enhance stem cell therapy and manage and prevent oxidative stress-related diseases. Oxidative stress-related disease, which include all kinds of degenerative diseases, immunological disease, chronic infectious disease, cancer, plus broad range of unmet medical needs involving chronic inflammation with emphasis on pain management. That's why we see that light therapy is being used for endless of clinical applications, work for many different kinds of degenerative disease, autoimmune disease, cancer. People, they may think that, this is maybe kind of snake oil, but the fact is that there is a chemistry behind it, there is a mechanism behind it, and the mechanism behind it is that those photomedicine works by modulation of nitroredox sensitive biochemical pathway. This is the, and because of that, we're going to really understand what is nitroredox modulators, first of all, and then you will see the giant biochemical pathway that I'm going to present after that. So nitroredox modulators, it can be biological modulators, stem cells considered as nitroredox modulators. Plasma-rich platelets are very rich with nitroredox chemicals, modulators such as thiol, nitroxide, or factor cytokines, and redox enzymes. Nitroredox could be also chemical modulators, thiol, nitroxidanus, polyphenol, ozone, hydrogen, carbon dioxide, 6-hormone, antioxidant, enzymes, cytokines, vitamin, and detoxification. They consider as chemical nitroredox modulators. And then we have energy modulators, nitroredox. Phototherapy is nitroredox modulator, electrotherapy, electromagnetic therapy, cryotherapy, sonotherapy, exercise, acupuncture, physical therapy, and low caloric intake. If you want to explain how this methodology works, how this energy medicine works, it works through modulation of nitroredox biochemical pathway, sensitive biochemical pathway. And here, this is the big giant biochemical pathway that shows the modulation of nitroredox sensitive biochemical pathway. And you can see here all this different modality of nitroredox, whether it is energy modality or chemical modality or biological modalities. They are all nitroredox modulators, and they modulate the nitroredox. They increase the nitric oxide bioavailability, and they modulate the redox signaling. And so here, by modulation of nitroredox sensitive biochemical pathway, we can treat oxidative stress-related disease, yes, enhance stem cell therapy. We can stimulate the mitochondrial biogenesis, activate beta oxidation, burn fat, and manage obesity. That's why we're using photomedicine for managing obesity, right? We also can, by light and also other nitroredox modulators, we can increase insulin sensitivity, manage diabetic complications such as diabetic neuropathy, diabetic angiopathy, and diabetic wounds, which we hear today about talking about diabetic wound, because really the mechanism of action is by increasing the sensitivity of insulin. By modulation of nitroredox sensitive biochemical pathway, we can improve the endothelial function, we can decrease the oxidative LDL, we can increase the HDL pyroxenase activity, and we can manage hypertension complications such as peripheral vascular disease, chronic heart disease, and arteriosclerosis. So here, by modulation of nitroredox sensitive biochemical pathway, we can unblock glutamate transporters. We can unblock the superoxide dismutase. We can restore neuralgia, antioxidant capacity, and activate an NMDA receptor, and manage gliosis, atrophy, hyperphagia, anemia, neural exotoxicity symptoms, and opioid dependency, which are caused by chronic use of narcotics. We find that chronic use of narcotics increase the free radicals, and so using those nitroredox modulators, we may be able to manage those cases, especially like, for example, photomedicine. We can also inactivate and oxygenate, increase tryptophan degradation, increase serotonin level, and manage depression. That's why we're using light therapy, one of them infrared. We can be used to manage depression, right? And this is the mechanism of action. So by using photodynamic therapy as nitroredox modulators, we can increase the free radicals, increase the redox potential level. This is how the mechanism of action of photodynamic therapy. We can shift the TH2 to TH1, induce apoptosis and cytotoxic immune destruction of cancer cells and the pathogens by using polyphenols such as curcumin, as a nitroredox modulator, we can block the COX enzyme, increase the capsaicin sensitivity to redox signaling, and induce cancer stem cell apoptosis. I think people are worried about using photobiomodulation because it stimulates cancer stem cells. So my recommendation, give them polyphenols, and that will help to increase the sensitivity of those cancer stem cells to the free radicals, and you can get rid from the cancer stem cell potential of being stimulated. So that is kind of an antidote for using photodynamic therapy with, caution, or you are being kind of caution about stimulating cancer stem cells. So I think if we do the polyphenols, or we recommend, or we ask the patients to take polyphenol, we may be able to oppose the effect of the photo stimulation of cancer stem cells. Also, we can modulate the immune system, shift the Th1 to Th2 by using the nitroredox modulators, or Th1 to Th2 to Th1, and manage the autoimmune diseases and allergies using nitroredox modulators. So if you apply the Nitromedicine 10 recommendations on your patient, you shall free them from the curse of oxidative stress-related disease, and receive Nitromedicine board certificate. Basically, me and the group of Nitromedicine, we will be able to give you this certificate if you apply our protocols on your patients. And this is the Nitromedicine 10 recommendations to manage oxidative stress-related disease and enhance stem cell therapy. I think this just shows that the oxidative stress-related disease diagnostic markers decrease the nitroside bioavailability, which is due to impaired nitroside production by endothelium, or increase in inactivation of nitroside by reactive species, are associated with endothelial dysfunction, autonomic dysfunction, sweat gland dysfunction, telomerase dysfunction, glutathione reductase dysfunction, which are able to used to diagnose them by performing endothelial function tests, ANS assessment tests, and pseudomotor and telomerase tests, and also the ratio between oxidized and reduced glutathione. So basically, this just shows how we can diagnose oxidative stress-related diseases. We can diagnose them by using pseudomotor tests. This is one, autonomic nervous system, endothelial function test. They are all diagnostic tests for measuring or diagnosing of oxidative stress-related disease. And I think during this session, we saw a lot of people are using some of those diagnostic systems, oxidative stress. I think the ratio between oxidized and reduced glutathione to assess the oxidative stress condition of the patient. And so what we are managing here, we are managing oxidative stress-related disease. And how we are doing it by modulation of nitroredox sensitive biochemical pathway, by buffering the redox, or by buffering the redox signaling, or decreasing the reactive oxygen species, the pathological ones, back to normal level, which is physiological ones, and also by increasing the nitroside bioavailability, we can manage all kinds of oxidative stress-related disease. And these are all oxidative stress-related diseases that can be potentially managed by nitroredox modulators, which includes photomedicine. We can diagnose them using endothelial function tests, pseudomotor, telomerase tests, and the ratio between oxidized and reduced glutathione. What's that? Oh. So let's talk about the history of nitric oxide. Nitric oxide is a gas that transmits paracrine autocrine signals in the organism. Signal transmission produced by one cell penetrates through the membrane, regulated function of the same other cells. That's what we call autocrine. The nitric oxide also can be transformed to endocrine signal, which is the nitrate, and regulated function of distant cells. Have you heard about nitric oxide inhalation being used for myocardial infarction and stroke, right? We inhale nitric oxide, and then nitric oxide will turn into peroxynitrate, right? And then peroxynitrate will convert into nitrate, and then the nitrate will be delivered by the blood as an endocrine signal to the target tissue, which is the brain and also the heart. Also, we have the paranasal sinuses. You hear about them, they're very rich with NOS, generate a lot of nitric oxide. And by inhalation from the nose, when we are breathing, and that's the best practice, is breathing by the nose, not by ear, we can get a lot of nitric oxide into the lung, which helps to increase the oxygen intake by the vasodilation effect. Also, nitric oxide has antibacterial effect. So inhalation or breathing from the nose is very important. It gives us the ability to take more oxygen to the lung, right? And also it helps to kill the germs and the bacteria. And I think it's called this process of nitric oxide being generated from the paranasal sinuses, and then the effect is in the lung. It's called aerocrine. So nitric oxide does have paracrine, autocrine, endocrine, and aerocrine effect. The discovery of nitric oxide as a signal molecule are awarded with 1998 Nobel Prize at Karolinska Institute. We have Dr. Robert, pharmacologist in New York. He concluded that blood vessels are dilated because of endothelial cells producing endothelial dilatation factor. Dr. Fred, he discovered in 1977 that nitroglycerin delays nitric oxide, which relaxes the smooth muscle cells. And Dr. Louis Agnaro, pharmacologist in Los Angeles, he concluded in 1986 that endothelial dilatation factor was indeed nitric oxide. And so nitromedicine helps to manage hard-to-manage disease, and we find that those hard-to-manage diseases have etiological converging on oxidative stress and disrupted production of nitric oxide. So our therapy is addressing the bioavailability of nitric oxide, target oxidative stress, which are the reactive oxygen species and reactive nitrogen species. And so nitric oxide mechanism of action, now known to be an immune modulator as well as neuromodulator. It's stimulating stem cell function, so it's not just a vasodilator nitric oxide. It actually has all this effect, which is a neuromodulator, immunomodulator, stimulating stem cell. Also plays a critical role in analgesia, vasodilation, angiogenesis, procyclic GMP, and it also has anti-cancer effect and antimicrobial effect by reacting with reactive oxygen species which generate peroxynitrate, and peroxynitrate kills the cancer and the infection. And so the common nitric oxide donors that we're using is nitroglycerin, L-arginine, and other nitric oxide donors, which were already prescribed medication. We have other nitric oxide donors, but those are the common ones. And so nitric oxide-related drugs is a promising pharmacological agent that has immune modulator, vasodilator, antioptotic, stem cell modulator, antigenetic, antithrombotic, anti-inflammatory, antimicrobial, anti-cancer, neuromodulator, analgesic. This wide-ranging rule of nitric oxide leads to development of a great number of synthetic nitric oxide compounds, which with a broad range of therapeutic uses. And we see here all the therapeutic use of the hydride of nitric oxide drugs. The mechanism of the action of nitric oxide-enating drugs, slow release of nitric oxide, lead to subtle change in pharmacodynamic of the parent drugs. For example, compared with NSAID, nitric oxide-donating NSAID goes markedly diminishes gastrointestinal toxicity because the NSAID goes block for both COX-1 and COX-2, right? While a nitric oxide does stimulate the COX-1, so it will help to increase the mucus secretion and counteract the effect of the NSAID blocking the COX-1. So that means it's kind of helping to prevent the GI toxicity. So this is an example. Also, acetaminophen, nitroacetaminophen is better than acetaminophen because nitric oxide works as an antioxidant and helps to clear the free radicals. So you can use more higher dose and less toxic with nitroacetaminophen versus acetaminophen. And there's many other nitric oxide-donating drugs that increase the efficacy of the parent drugs and minimizing their side effects. An example is, and we're using it for many clinical conditions, and there are many of them here. We are using to manage, for example, cancer with nitric oxide-donating aspirin and also nitroglycerin. We can use to manage pain by using nitric oxide paracetamol. It will increase the efficacy of those parent drugs and also helps to minimize the side effect. We can use Alzheimer's disease, can be used by nitric oxide-donating propene or nitroxide releasing uric acid, or a nitroxide donating taccharin. So there's many, all those drugs that we are having right now, there's companies who are hybriding it with nitroxide to increase its efficacy and minimize its side effect. So what is the issue of long-term use of nitroxide? The problem with long-term use of nitroxide, that's what we are using it for managing angina, right? Myocardial infarction or angina, so we're using nitroglycerin. But the problem with nitroglycerin by itself, if we use it chronically, it can react with the free radicals, generate peroxynitrate, and actually kills the heart cells. So it's very important to, when you are using nitroglycerin or nitroxide donors, you have to use what antioxidants to make sure that the nitroxide is not reacting with the free radicals. The nitroxide is doing the good thing, which is vasodilation, which is actually what we need in case of angina. So generation of reactive nitrogen species, inhibition of the mitochondrial respiratory chain, resulting in a decrease in ATP production and susceptibility to cell death. The reversible binding of nitroxide to mitochondrial cytochrome oxidase, possibly sensitizing the tissue to hypoxia. So it can block the nitroxide, the mitochondria with chronic use of nitroxide and kills the cells. And also, peroxynitrate that's generated by nitroxide combining with a free radical can reversibly inhibit mitochondrial respiration at multiple sites and cause increase in the permeability transition and induction of the cell apoptosis. So what is the answer? How we can prevent this from happening is giving antioxidant with nitric oxide. It's very, very important. So people who are taking nitroglycerin for their angina, I recommend them to also take thiol, vitamin C, and it's supposed to be in the mainstream, or they can combine nitroglycerin with those antioxidants just to make sure that the nitroglycerin is not ending up producing peroxynitrate and damaging the heart. So nitroxide donating nitroxide donors with antioxidant to neutralize the deteriorating effect of the active oxygen species, the active nitrogen species, maintaining nitroxide bioavailability. So this is one way of keeping it, is by adding antioxidant. The other thing is detoxification. Have you heard about detoxification? People doing detox centers, detoxification, right? You move the free radicals. When you move the free radicals, you're preventing the nitroxide from combining those free radicals, and you're increasing nitroxide bioavailability. So you are maintaining that level, which is very important, right? So detoxification to remove the pathological free radical generators and increase nitroxide bioavailability. Also, low-level laser therapy also works as an antioxidant. Dissociate nitroxide from the cytochrome oxidase, from the hemoglobin, from the myoglobin, buffer the redox status, and neutralize the deteriorating effect of reactive oxygen species and reactive nitrogen species, maintaining the nitroxide bioavailability. Electrotherapy. Electricity is actually a form of antioxidant, of nitroredox modulator. Electrotherapy delivers electrons to the body. It may help to saturate the free radicals with electrons, thus eliminating underlying oxidative stress, stabilizing mitochondria, preventing further formation of pathological free radicals, and increasing nitroxide bioavailability. Have you heard about electron therapy being used for tension and all that? It's not just interrupting the signal of pain, but actually it helps to reduce or buffer the free radicals, and that leads to decreased inflammation. Release nitroxide activates the 1,8 cyclase, increasing the cyclase 1,8 monophosphate level, which modulate the immune system, increasing the blood flow and stimulate the stem cell proliferation, differentiation, and migration. So this is the mechanism of action of how nitroxide works in those different variety of oxidative stress-related disease. Okay, so the other thing is that we can increase the efficacy of the platelet therapy, right? And also stem cell therapy. Platelet-rich plasma efficacy increased by blue light radiation. Have you heard about platelet, photoactivated platelets? They're using platelets for treatment for you. We can increase the efficacy of the platelet by radiating the blood, the whole blood, with light and then extract the platelets. The blue light radiation for 150 nanometer of the whole blood leads to increase the nitroxide, deoxyhemoglobin dissociation. It shifts the blood redox to reduction, and also decrease the peroxynitrate level, increase nitroxide bioavailability of that transfused PRP, and that will increase the efficacy of the PRP therapy. Also, stem cell therapy. There's also further stem cell therapy. With light, we can also increase the efficacy of stem cell therapy. It's the same concept of when you are trying to plant a seed, right, in the ground. It would be nice if we put fertilizers, nitric oxide, nitrate, right, and lime. The same thing, your stem cell therapy, I don't think it's a wise to just dump it into inflamed joint. It will be good if we control the microenvironment around the stem cells by using phototherapy light and also pharmaceutical using nitroxide donors and antioxidant. And so LFT, we are platelet, plasma-rich platelets, nitroxide, electrotherapy, detoxification, antioxidant, really increasing the effects of stem cell therapy, and nitroxide and platelet-derived growth factors from the platelet stimulate stem cell proliferation and differentiation. Is it done time? Do you have questions?
Over time.
5 minutes? Okay. Okay, so here, infrared and red low-level laser therapy in healthy tissue. What it will be the desired result in healthy tissue, not pathological tissue, it's increasing the respiration and generation of ATP, creating physiological oxidative stress. Not pathological, there's a difference between pathological oxidative stress and physiological. The physiological one is the one that we need, right? Because the physiological oxidative stress does stress your stem cells and tissue to generate antioxidants. It really stimulates the downstream effect, and we don't see that. It's called microhormesis. Under normal conditions, a certain proportion of cytochrome oxidase is bound to nitroxide, inactivating it. Red and infrared light dissociate nitroxide from cytochrome oxidase, leading to increasing aerobic respiration ATP level, increasing nitroxide bioavailability. It leads to rising cyclic GMPs and stimulation of stem cell proliferation and differentiation. The active oxygen species, which is physiological level, will increase and this will lead to increased shifting of the redox state fats to physiological oxidative stress, which is something good, right? And this is how this works, infrared with animation, how it will increase the free radicals and nitroxide bioavailability and shift the redox status to oxidation, physiological oxidation. So the mechanism effect of low-level laser therapy, cellular redox potential shifted toward physiological oxidative stress, leading to transcription of protective antioxidant genes, anti-apoptosis, enhances stem cell proliferation, differentiation, and migration. It is similar to the microhormesis effect of chronotherapy, ozone therapy, cryotherapy, sonotherapy, electromagnetic therapy, acupuncture, electrotherapy, plasma-rich platelets, plasma-rich platelet therapy, fasting, physical therapy, and exercising. What about the effect of infrared and red under hypoxia pathological oxidative stress? It's a bit different. It's not microhormesis, it is phototrophy effect. Nitroxide is dissociated from cytochrome oxidase, that's what will happen, and then we will see the ratio of NAD to oxygen level is very high under hypoxia and pathological oxidative stress condition. And then the NAD will compete with oxygen as an electron acceptor for LLT, low-level laser therapy. Photoxidized electrons of the cytochrome oxidase, which leads to phototrophy. So what will happen, those NAD will be reduced by those photoxidized electrons of the light. The nitroxide cyclic GMP level increase, stimulating stem cells and vasodilation. It also increase and reduce the species with NADH because they will be reduced by this photoxidized electrons instead of giving it to the oxygen becoming free radicals. Those electrons will be delivered or donated to NAD and they become reduced, right? And then the NADH can be converted to ATP from the mitochondria. The level of that reduced glutathione will increase because NASH part of it will reduce the glutathione, and the cellular redox status will shift to the reduction and decrease the inflammation. So that's how the mechanism of action of anti-inflammatory effect of the light. This is the animation here. Alright, so you see here the NAD turned into NASH, and NASH will be reducing the glutathione, right? So the blue light level therapy, nitroxide will be dissociated from deoxyhemoglobin into resides. Free nitroxide and reactive local reactive oxygen species forming peroxynitrate. Peroxynitrate reduces the peroxyredoxin reduces peroxynitrate to nitrate, and nitrate will be converted to nitric oxide in water by the oxyhemoglobin. The end result is the reactive oxygen species are reduced, the nitric oxide bioavailability will increase, and the redox status will be shifted to reduction. And this is the animation of how the blue light mechanism works in increasing nitric oxide bioavailability. Okay? Reactive oxygen species reduced here, nitric oxide bioavailability increased, and redox status is shifted to reduction system. Still we have time? Couple of minutes, okay. So this is just a summary of how the mechanism of light action, the mechanism of action of the light. And I think it's just a summary of what we just read, and if you have any questions, we can go after this, so I have to finish up the rest. So electrotrophy of the microcurrent therapy. Have you heard about electromedicine, TENS spinal cord stimulators? They're not just interrupting the signal of pain anymore. They are actually immune modulators. They are Nitroredox modulators. Delivering electrons to the body may help to separate the free radicals and the NAD with electrons and relating underlying state of stress, stabilizing mitochondria, prevent cause formation of pathological free radicals, and increase the nitric oxide bioavailability. Increasing mitochondrial inner membrane flux potential gradient, which can design the mitochondrial inner membrane proton pumps, which leads to increase in the mitochondrial inner membrane hydrogen potential gradients, which in turn convert the ATP chemical potential by the ATP synthesis. So this is the mechanism of action of how electrotherapy works as an anti-inflammatory and how it increases the ATP. And also we'll find out nitric oxide, cyclic GMP level increase, stimulating stem cells and vasodilation. So electrotherapy does stimulate stem cells. So that's why we recommend people who are doing stem cell therapy in their joints to also do braces. There's electromodulation braces that helps to keep the stem cells stimulating. It also increases in reducing species of NADH, which is very important to reduce the glutathione to reduce glutathione, because that's oxidizing to reduce. Level of reduced glutathione will increase, which is good, right? And cellular redox status to shift to reduction and decrease the inflammation. This is the animation of microcurrent therapy and how the electrons are neutralizing the NAD, and NAD will reduce the glutathione and work as an anti-inflammatory and also an immune modulator effect here. Right? And this is called electrotropy effect. So nitric oxide redox in the immune system, maintaining the TH1 and TH2 balance. Low level leads to TH1 dominant condition and a similar immune response. Low level nitric oxide. High reactive oxygen species causes further shift toward the TH1 dominance, causing oxidative stress, cytotoxic immune response, and inflammation. High nitric oxide level will shift the balance toward the TH2 dominance and decrease inflammatory response. Low reactive oxygen species causes further shift toward the TH2 dominance and causing anti-inflammatory effect. Increasing nitric oxide level induces COX-1. That's why it's good for coupling it or hybriding it with aspirin, and inhibit the COX-2 and the LOX, right? That's why nitric oxide donating NSAID will be a good option, better than the NSAID by itself. It will minimize its toxicity. And this is just showing how the nitric oxide redox modulate the immune system. It is very important, this is maybe the last thing I'm going to mention here, that when we are doing platelet-rich plasma therapy, we are extracting the platelets. It will be good if you also use the white blood cells too. So try to extract the white blood cells and the platelets together and use it, because white blood cells itself, we think that it's all the time it is inflammatory cells, right? But that's not true. Really, the white blood cells can secrete anti-inflammatory cytokines as well. It can secrete pro-inflammatory cytokines. It depends on the redox potential of the microenvironment around the white blood cells. So white blood cells, if we control the environment, if the redox potential is low, it secretes anti-inflammatory cytokines and starts stimulating the healing process. If it's in the environment of free radicals, it really does more damage. And so I think treating the blood with light will help to activate the platelets and help to buffer the redox, and extracting the blood, the white blood cells with platelets, it's a better option than just injecting platelets by itself, because you get the benefit of the white blood cells in stimulating the joint that's been damaged due to degenerative disease like osteoarthritis. Okay, do you have any questions? Because I think the time is done, right? Thank you. Any questions?
Okay, I have a question. So maybe you try to promote the system to increase the NO, but specifically, what do you want to achieve? What methodology you want to
I want to manage oxidative stress-related diseases. And let's say, for example, pick one of oxidative stress-related disease. Let's say, for example, angina, right? So angina, what we have problem with the blood vessels, right? They are kind of constricted, and endothelial dysfunction. So how I can improve that? By radiating the light or by giving nitroglycerin, we can increase the nitroxide bioavailability, which open up the blood flow and vasodilate, right? And that leads to treatment of angina. At the same time, the light helps to buffer the redox to make sure that nitroxide will not become peroxynitrate and damage the heart. That's why there is a problem of chronic use of nitroglycerin. I think combining it with light therapy, we will be saving a lot of life, and we can prevent the side effects of chronic use of nitroglycerin.
So your purpose is to use different methods to manage this?
Yes, to control the nitric oxide, because chronic use of nitric oxide by itself, it can become deteriorating because they will react with free radical, become peroxynitrate and causing the damage. So we need to prevent that by giving antioxidants. And antioxidants or nitroredox modulators, there are many ways. There are light, electro, antioxidants that we're using, thiols, polyphenols, right?
Okay, other questions?
Any questions? Yes.
I was interested in what you were saying in blue light, because blue light is antibacterial in certain dosage levels and actually pumps up reactive oxygen species, whereas you were discussing it in decreasing ROS. I guess it must be a dosage question, and I ask this because there's some excellent published literature that demonstrates increased ROS with blue through protoporphyrin breakdown causing bacterial kill.
Yes, if you want to kill, then you need to increase the free radicals into toxic level to kill those cells, and those react with nitric oxide, become peroxynitrate and damage the cells. That's how the photodynamic therapy works, through killing the cancers by increasing the free radicals, and also you can add nitroglycerin to it, which helps also to increase the nitric oxide, and once they combine and become peroxynitrate, those peroxynitrate, they are anti-cancer and antibacterial, so that's what you need.
So I think that the point is that the dosage in all of this is again something we need to be careful of or watch, because simply throwing blue light into something at a dosage level that the patient, for example, may have a home device and they're using it all the time, we have to ask ourselves.
Okay, again about the blue light. I'm saying here in the blue light.
Yeah.
The red, actually the blue light, it doesn't, inside, not in vitro, in vivo. And because of the hemoglobin, it contains a lot of nitric oxide. When you are radiating the blood, the nitric oxide will be released, and the nitric oxide will react with the peroxynitrate, and it clears the free radicals, right? Because nitric oxide now become like an antioxidant, react with reactive species, become peroxynitrate, and then you have the thiols and peroxyredoxins of the red blood cells will start recycling the peroxynitrate back to nitric oxide. So the fact is that here, in this situation, the blue light is actually buffering the redox. It's actually lowering the redox, lowering the pathological free radical back to physiological level. And so I see this is an opposite effect of you're talking about when we're talking about the bacterial. Yes, that's a different scenario when you have all those chromophobes that will absorb the blue light and release the free radicals. And we need that and that's why we can do photosensitizers to increase the free radicals to kill the bacteria. So I don't think just by blue light itself, it does increase the nitric oxide, yes, and nitric oxide possibly react with the free radicals because the infection, the area of the infection itself contains a lot of free radicals, which will enhance the process of killing the bacteria. And that is true. But again, you will enhance the efficacy of the blue light by giving photosensitizers, and the best photosensitizers for the blue light is curcumin, the polyphenol. It's absorbed, that's being used in the publications about using curcumin to manage gingivitis and infection using curcumin along with blue light. So if you want to kill the bacteria, use the blue light with polyphenols.
Okay, thank you.
Thank you, Phil. Thank all the speakers today. Thank you.